Hi, my name is April Showalter, and I'm the Physician Assistant at Allergy Asthma Associates. Today we're going to talk about spirometry. It's a pulmonary function test that we use in the office to diagnose asthma. What you do is when you initially come in, we'll take a reading, give you a bronchodilator called albuterol, wait 15 minutes, and then take an additional reading. The change that we see from the first reading to the second is what allows us to diagnose asthma. Today we're going to have Allie demonstrate how to do spirometry. So first we're going to take the plastic cover off, hold the mouthpiece in your mouth, lips tightly closed over the mouthpiece, and I'll press start. When you're ready, take a deep breath in and blow as hard as you can. Blow, 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 and deep breath in. Thank you, Allie. You can take that for me. So that's how you do spirometry, but we'll actually have you do several efforts. So we can do 3 to 8 different efforts to get an accurate reading. If you think that you suffer from coughing, wheezing, shortness of breath, and that you might have asthma, check us out on our website or call our number to schedule an appointment and consultation today. Thank you.